So you guys, we're gonna get started in a little bit. I'm just giving people a chance to log in. We will start this meeting at 10:05. If you have any questions, we have a questions panel at the bottom. Thank you. I see a few people have questions. It looks like Brian, you had a question. I am going to mute everybody. If you have a question, you can raise your hand or type it in the questions box below. And what I'll do is I will read it to Christy or get her attention during the presentation. But we're going to try to hold all questions until the end, okay? So we are going to get started. I want to welcome everyone to the Medicare Supplement webinar. You are joining Christy Biddy, your Vice President of Health Insurance Services. She has over 30 years of health insurance experience. I want to welcome Ms. Christy Biddy.
Hi, good morning, everyone. Thank you for attending our webinar. Hopefully you will find it very useful and informative. And as she said, we will have a question and answer session at the end. So if you have any questions during the presentation, make note of those. Be sure and ask them at the end. If you're more comfortable speaking directly to me, that is totally fine. I will be available either by email or phone after the presentation, and happy to help you that way. But hopefully most of your questions will be answered actually during the webinar. So let's get started this morning. So what we're going to go over today is basically enrolling in Medicare, the parts of Medicare, which is your Medicare Part A, which is the hospital coverage, your Medicare Part B, which is your medical coverage, or basically any coverage that is done outside of the hospital. We also will go over Medicare Part D coverage, which covers your prescription drugs. We'll touch on just a little bit on your Medicare Advantage plans and exactly what they are and why they're different from Medicare. And then we will also go over Medicare Supplements, and they are also called, you may have heard them referred to as Medigap insurance. Okay, so enrolling in Medicare, we have a screenshot of the actual Medicare.gov homepage right there. You can enroll directly in Medicare from right there. And if you look across the top, the blue tab all the way over to the left, you'll see it says sign up or change plans. There is a 7-month initial enrollment period when you are about to turn 65. You can start the enrollment process 3 months before you turn 65, the month you turn 65, and then 3 months after you turn 65. That is your original enrollment period. Now, say for whatever reason you do not want to enroll in Medicare at that time when you turn 65, you just need to be sure that once your regular healthcare coverage ends, that you go ahead and enroll in Medicare then, so there is no lapse in coverage. The other thing that you can do is, if you don't enroll during your initial enrollment period, is enroll during the Medicare open enrollment period, which is every year from October 15th through December 7th. It's kind of hard not to be aware of it because we're inundated with commercials every year that it's the Medicare open enrollment period. Now, the one thing to note, if you decide not to originally enroll in Medicare and you go without credible coverage for whatever reason, and then you do go to enroll, that generally they will charge you a 10% penalty for a late enrollment. And that is not a one-time penalty. That will be forever tacked on to your premium. So that could get very expensive for that. Now, the thing to note about enrolling in Medicare is that if you're on the GDIS health insurance, you are not required to come off of it when you turn 65. You can remain on the GDIS health insurance as long as you're a member of the GDIS. Now, to be honest with you, though, the majority of people do come off our coverage and they do enroll in Medicare because they're really, if the premiums aren't the same, they're going to be less. They're usually never more, and you're really going to get more extensive, comprehensive coverage, have less out-of-pocket cost on Medicare than you would with a traditional health insurance policy. The other thing to note about Medicare is that there is no provider network. You can't go to a website and look it up and see if the doctor accepts Medicare. Unlike traditional health coverage, where the carriers will go out and contract with each provider on what they're going to reimburse them for certain procedures or tests or whatever they do, like office visits, Medicare does not do that. Medicare says for office visit, for a doctor's office visit, we're going to reimburse the provider, the doctor, X amount of dollars. And the doctors and providers know that, and they either accept Medicare or they do not. So the best thing, if you're thinking about going on Medicare, you want to be sure that your current doctors do accept it, is just to call them and say, hey, I'm thinking about going on Medicare. Do you still, can I still be a patient, or do you accept Medicare if I go over on that? I've not had one person tell me and call me and tell me that their current provider or doctor has not seen them, have canceled them, so they can't be a patient anymore because they go over on Medicare. So I don't think that's really an issue for most people. Okay, now Medicare Part A is hospital coverage that helps cover the costs for basically inpatient when you're in a hospital, or it also will cover a skilled nursing facility. It will not cover custodial or long-term care coverage. It also will cover hospice and some home health care services. Now, the thing to know about Medicare Part A and Part B is that you will hear it sometimes referred to as original Medicare. This is the one that has been around before the prescription coverage, before the Medicare Advantage Plan, so it is sometimes called original Medicare. You do not have a choice of carriers on original Medicare Part A or Part B. It is directly through the federal government. There is no premium associated with Medicare Part A. As long as you've worked in the United States and paid Medicare taxes, there will be no premium. I've had a lot of people tell me that they get notice from the federal government when they turn 65 that they have been automatically enrolled in Medicare Part A, and that is totally fine. There's no premium associated with that. If they do enroll you, go ahead and enroll you in Medicare Part A. If you're insured through the GDA insurance will be your primary coverage, and Medicare would be your secondary coverage. For 2020, there is a deductible on the Part A coverage of $1,408 per benefit period. Now, a benefit period begins on the first day you receive service as an inpatient in a hospital and ends after you've been out of the hospital and have not received skilled care in any other facility for 60 days in a row. So it is not per calendar year, it is per benefit period, and a benefit period is 60 days. So say, for example, someone goes in the hospital in January, they're going to meet that deductible. They come out, they go back in February, it's within the 60 days, so they're not going to have to meet that deductible again. But then say they have to go back in June, it's outside that 60 days, they're going to have to pay that $1,400 again. And then say they come out and go back in October. Again, they're going to have to meet that $1,400 deductible. So under Medicare Part A, actually you could end up having to meet that deductible several times in a calendar year, since the benefit period is only every 60 days. And besides the deductible, you will have additional out-of-pocket for your co-insurance. Okay, Medicare Part B is your medical coverage that covers the cost for doctor services, doctor visits, hospital outpatient care, some home health care services, as well as your lab tests and your durable medical equipment. Most preventive services are included, including an annual wellness exam. So basically your Medicare Part B is your coverage outside of anything doing outside of the hospital. Now, there is a premium associated with your Medicare Part B coverage. And if you look at the chart that we have posted right up on the right-hand side of the screen, that is what the premiums are for 2020. The minimum premium that you're going to pay for your Part B coverage is $144.60. Now, the premium is based on your adjusted gross income from your tax return from 2 years ago. So for 2020, it would be based on your adjusted gross income on your 2018 tax return. The $144.60 monthly premium is for an individual if their income, adjusted gross income, was $87,000 or less. And if you look on the chart, there are 5 other brackets on there, with the maximum being if you file a joint return and your income was $750,000 and above, your monthly premium is going to be $491.60 per month. Now, they should automatically adjust your premium every year. So you need to, once you go on Medicare, you need to be aware that they are doing that. You need to, every year when you get what your premium is going to be, you need to be sure that they're basing it on your income from 2 years ago. Because as you get older, most people either retire completely or start working less and less, so their income goes down. So just because, say, like you come into Medicare at that $491.60 premium, that's not necessarily what it's going to stay. They should adjust that as your income goes down as you get older. Now, for 2020, the deductible is $198, and that is per year. That is not per a 60-day benefit period. The thing to note about Medicare Part A and Part B, the deductibles generally do change every year, but not usually by much. For 2019, your Part B Medicare Part B deductible was $185, so it only went up $13. But the thing, like I said, to be aware of is that it can increase. Generally, also your premiums for your Medicare Part B coverage will increase also. But to give you an idea, like I said, the minimum premium is $144.60. For 2019, that minimum premium was $135.50. So again, can go up, generally not by much, but there is no guarantee on on what the increases will be. On Medicare Part B, you also have additional out-of-pocket costs for your co-insurance, which is generally your portion is going to be 20% after you meet a deductible. And then also excess charges on Part B. Excess charges are above and beyond what Medicare has agreed to reimburse for certain tests or procedures. So you would be responsible for those excess charges also. Now, your premium on Medicare Part B is paid in one of two ways. If you're already getting your Social Security benefits and you're getting that monthly check, your Part B premium will automatically be deducted out of your Social Security payment. Otherwise, if you're not getting Social Security, then you would pay that premium directly to the government. Okay, now Part D is your standalone prescription drug coverage. The thing to note, there is no drug coverage under original Medicare Part A and Part B. The only exception to that is if you're actually in the hospital and they have to give you drugs while you're in the hospital, your Part A coverage will cover that. But outside of that, you have no drug coverage whatsoever outside of a Medicare Part D prescription plan. The thing to note about this, it helps pay for many brand name and generic prescribed drugs, and it often gives you access to mail order options in retail drugstores across the country. You see advertisements on TV all the time, Walgreens, CVS, Walmart, about how they accept the Medicare Part D prescription plan. So most of your pharmacies will accept the prescription drug coverage. Now, when you get ready to enroll in a prescription plan, you can do it directly at Medicare.gov. And again, if you look, the little chart that we have, it's a screenshot to the right, is the Medicare page, the Medicare.gov page. Across the top, you'll see there is a drug coverage tab that you can directly click on. Once you click on that, over to the left, you'll see it says how to get prescription drug coverage. And then down at the bottom, you click on find a Medicare drug plan, and you can just click through the prompts right there. Of course, if you know a carrier because you do get to choose who your carrier is, your prescription drug plans are not directly through the federal government like Medicare Part A and Part B. So if you know a carrier that you want to use for your drug coverage, you can go directly to their website and enroll there. The reason I recommend Medicare.gov, most people don't know who they want their carrier to be. So if you do it through Medicare.gov, you go through the prompts. If you're on any type of maintenance drugs, it will ask you to put those drugs into the system, even including the milligrams, and then the system will come up and tell you, generally there's 3 tiers of coverage, your basic, your middle of the road tier that covers the really expensive drugs. It will tell you which tier covers those drugs, and it will also give you a list of the carriers that cover those drugs, along with what the monthly premiums would be for those drugs. So that's why I recommend doing it through Medicare.gov. It's kind of one-stop shopping instead of having to go to each carrier's website and keep re-entering your information to see what your monthly premiums are going to be. Now, the other thing I recommend also is if you have a retail pharmacist that you know, you could always ask them. They deal with these prescription drug plans 100 times a day. They're a good resource. Now, some of them are willing to give you recommendations, some of them don't, but it doesn't hurt to ask. I've had several people tell me that they did talk to their pharmacists and they recommended one plan or this plan because they deal with them. They know the carriers that nobody has issues with getting their drugs covered or getting their claims paid. So it's definitely worth, just a question to your pharmacist to see if they will give you a recommendation. Now, when you do go to enroll in a prescription drug plan, then the thing to know is that you can go a maximum of 63 days without credible drug coverage, without having to pay a penalty when you do go to enroll. I've had people ask me when I help them enroll in a Medicare supplement, they said, well, I'm not on any maintenance drugs. I'm not going to enroll in a plan right now. I suggest to them that is not a good idea. Because if, say, like you're on our health insurance coverage and you stop it to go on Medicare Part A and Part B, and then you do not enroll in a drug plan for 2 years, 24 months. When you do go to enroll in that drug plan, they will charge you a 1% penalty for every month. So in this case, 24% when you on your premium. That is not a one-time penalty. That is forevermore as long as you're enrolled in a drug plan. So even if you're not on any type of maintenance drugs, I do recommend enrolling in one. Just get the cheapest thing that is out there so you do have credible drug coverage and do not have to pay that penalty. Now, the thing to know about the prescription drug coverage is you can change it one time every year during the Medicare open enrollment period. And again, as I said before, that is October 15th through December 7th of every year. So you need to up your tier of coverage within a carrier, within a plan that you already have. You can do it then. Say you, for whatever reason, don't like the carrier you have, you would be able to switch carriers at that time also. So you can do that one time every year. But like I said, I definitely recommend do not go without a prescription drug plan, so you do not have to pay that penalty. Okay, Medicare Part C is also called Medicare Advantage plans. We do not currently offer Medicare Advantage plans, so I'm not licensed to sell that. So I just want to give you the basics of exactly what a Medicare Advantage plan is. Now, when you enroll in Medicare, you're going to go one of two ways. You're going to go with original Medicare Part A, Part B, your optional Medicare Supplement, or with a Medicare Advantage plan. You do not do both. You do one or the other. Now, Medicare Advantage plans will take the place of Part A, Part B, your Medicare Supplement, and a lot of the Medicare Advantage plans can also include your Part D drug coverage. If you go with a Medicare Advantage plan, you will not get a Medicare Supplement. You do one or the other. Now, most of the Medicare Advantage plans, really, they're more like your typical health insurance coverage, where you have a copay when you go to the doctor, you have deductibles, you have co-insurance. And most of the Medicare Advantage plans do have a network. They're generally PPO or HMO networks. Now, the thing about Medicare Advantage plans, you will probably have a lower premium than you would going with original Medicare or a Medicare Supplement. Some of them even have a zero premium, and it is income based. But the thing to know about this is most of these plans are not as comprehensive in coverage as original Medicare and a Medicare Supplement. So just like with most health insurance coverage, if you pay a lower premium, which you would with a Medicare Advantage plan, when you do go to use the insurance, you're going to have more out-of-pocket cost. Now, and if you pay a higher premium monthly, when you do go to use your coverage, you're going to have lower out-of-pocket costs. And that is the same thing with either original Medicare or your Medicare Advantage plan. The thing to also know about Medicare Advantage plans, they are not done directly through the federal government. You will have to choose a health insurance carrier on that. Again, you probably see tons of advertisements on TV about Anthem's Medicare Advantage, United, Cigna. Most of your major carriers do offer those plans, and you will see those ads again during the Medicare open enrollment period every year. Now, on your Medicare Advantage plan, it does require annual enrollment, so you will have to renew that policy every year. It's not auto-renewable. Okay, Medicare Supplement plans, which you also hear referred to as your Medigap insurance. Now, we can help you with a Medicare Supplement plan. Our carrier is Anthem, is who we offer ours through. And hopefully you will use us when you decide to go with a Medicare Supplement plan. But if you don't, I highly suggest that you get some Medicare Supplement plan, because as we were going over before, just on Medicare Part A alone, you could end up meeting that $1,400 deductible several times in a year span. So that Medicare Supplement plan, according to which one you go with, will cover that Medicare Part A deductible regardless of how many times you have to meet it per year. So the thing to know about Medicare Supplements are they supplement Medicare Part A and Part B. There is no supplemental drug coverage for your Part D prescription plan under a Medicare Supplement. It is only going to supplement what Medicare Part A and Part B does not pay. It will pay your deductibles, again, according to which plan you go with. It will pay your co-insurance. It will pay your excess charges. If it is not a covered expense under your Medicare Part A or Part B, it is not going to be a covered expense under your Medicare supplement. For example, Medicare is not going to cover cosmetic surgery, voluntary cosmetic surgery. Your Medicare supplement is not going to pay for that either. Now, Medicare supplement plans, they are federally mandated on what they have to cover, but the coverage itself is not directly through the federal government. You have a choice of carriers for that. And again, the one that we use for our Medicare supplements are the Anthem Medicare supplements. Now, regardless of who your carrier is, all Medicare supplement plans are exactly the same because they are federally mandated on what they have to cover. So a Plan F or a Plan G or a Plan A or a Plan N, whether it's with Anthem, United, Cigna, Aetna, it's going to be exactly the same. The differences that you're going to find between Medicare supplement plans are, of course, the premiums. But since they are federally mandated on what they have to cover, all of the carriers have to be very competitive with their premiums, because if they're a lot higher than another carrier, nobody's going to go with them since the plans all cover the same thing. So most of the time, your premiums are going to be very comparable between your carriers. The other differences are the discounts that you might receive with it. For example, Anthem gives a discount for doing an auto debit to pay your premium every month. They also give a discount if you pay your premium up front for the whole year. There is a household discount that if two family members within the same household are on an Anthem Medicare supplement, then both of y'all would get a 5% discount every month. And the other thing that I find that a lot of people are really excited about is you automatically, with the Anthem Medicare supplement, you automatically get enrollment in their Silver Sneakers program, which is a free gym membership. And the number of gyms that participate in this program now are up to about 15,000 nationwide. So you have a very big choice in your gym membership, but that's automatically included with an Anthem Medicare supplement plan. Now, also the thing to know when applying for a Medicare supplement, it is guaranteed issue within 6 months of your Part B effective date. So as long as you enroll in your Medicare supplement plan within 6 months of your Part B being effective, it's guarantee issue. You do not have to answer the health history questions. You do not have to go through underwriting. You do not have to be approved. They have to enroll you in the plan. Now, if you go outside that 6-month period, you do have to go through underwriting. You will have to be approved, and you could be turned down for your Medicare supplement coverage. You can change your plan at any time you want to, but what I suggest to people is the plan that you originally enroll in when you go into Medicare is probably the plan you're going to want to stay with, because like I said, outside that 6-month period, you would have to go through underwriting and be approved for it. So if you do want to change 2 years down the road from the carrier that you have your supplement plan through, you can definitely do that. Just be sure and not cancel your existing supplement plan without getting approval from the new one that you've been accepted into it. Because if you go ahead and cancel your existing one, and then the new one turns you down, you don't pass underwriting, then you would have no supplement plan whatsoever. And there is no fee to apply. So if you do want to see if you can apply for another plan, another carrier, there is no harm in doing that. Just do not cancel your existing supplement plan. Medicare supplements are auto renewable every year. You do not have to go in and apply from year to year. The only reason the carrier would cancel you is for non-payment. So it just carries from 1 year on to the next. You do have to be enrolled in Medicare Part A and Part B prior to enrolling in a Medicare supplement plan. Your Medicare ID number and your effective date of your Medicare to see if you get qualify for that guarantee issue is required, at least on the Anthem application. So you do have to have done that prior to applying for your Medicare supplement plan. And the other thing to know is you have to enroll in a supplement plan in the state of your legal residence. I've had people ask me, well, how if I live part of the year in one state, part of the year in another state, which one do I apply in? Is well, the best thing I can say is whichever one you put as your legal residence on your tax return. That would be the state that you would need to enroll in your Medicare Supplement plan. Okay, now the premiums. Again, our carrier is Anthem. So the premiums that we have listed right here are the premiums that are currently being offered for the supplement plans through Anthem. The premium is based on the county you live in. If you look at the chart to the right, it's going to show Area 1 and Area 2. Area 1 is your more metropolitan area. Area 2 will be your more rural area. So there is a slightly higher premium for your Area 1 premiums in your Area 2. There is also a difference in non-tobacco versus tobacco users. The chart that we have listed is for not having used tobacco products in the past 12 months. And then it is also based on gender and age. The male premium is usually a little bit more than the female premium. And of course, as you age, your premium is going to go up a little bit also. But you can see on here, for 65, a male in Area 1, Plan G is 127. When you go up to 66 to 69, it only goes up $6 to 133. So the differences are not that tremendous. Now the premiums also are paid directly to whatever carrier that you choose, and you can set up multiple ways of paying the carrier. You can do auto debit. You can set it up for quarterly payments, yearly payments, monthly payments, or you can pay them directly via check, or you can set it up where they auto debit it out of your account. Now, the one thing I want you to note on the chart is the differences between, now we offer plan A, F, G, and N, but the two plan, really the plan that I suggest you go with is plan G because of the premium difference. Now, the thing to note about plan F, anyone newly eligible for Medicare as of January 1 of 2020 cannot enroll in a plan F. Only people eligible for Medicare prior to January 1 of this year can still enroll in a plan F. But I recommend people go with plan G anyway because of the premium difference. The only thing that plan G does not cover that plan F does cover is the Part B medical deductible, which is $198. So if you're looking at the male chart for Area 1 for 65 years old, you're looking at the premium $181 for a male and $127 for Plan G, $181 for Plan F. That is almost $60 a month, which is almost $720 a year. And the only benefit you're getting by going through Plan F is that $198 deductible paid. So that $198 benefit will cost you about $700. So because of the premium difference, really makes more sense to go with Plan G. Okay, now the benefits charts. This is very good to note right here. It tells you what is all covered by the different plans. Now, like I said, we offer the Anthem supplemental plans A, F, G, and N. And if you look at Plan F, it will cover everything. It will cover your deductibles. It will cover your co-insurance. It will cover your excess charges. So with Plan F, as long as it is a covered expense through Medicare, your out-of-pocket will be $0 for additional costs. For Plan G, it is going to cover your Part A deductible. It is going to cover your excess charges. It is going to cover your co-insurance. The only thing that Plan G does not cover that Plan F does is, again, that $198 deductible, but your premium difference between Plan F and Plan G is going to be somewhere between $600 and $700 a year. So to me, it just makes no sense to pay that much in premium for less than a $200 benefit. Now, we have this chart. Don't worry about having to write everything down. It is posted on our website. When you go to GDIS plus.com/Medicare. We have an Anthem booklet there, and this chart is in that booklet along with the premium, the other chart that we just showed you, the monthly premiums and everything. And it goes over more in detail about exactly what plans A, F, G, and N cover. So again, it is posted on our website right there. Again, I just want to stress that only people eligible for Medicare prior to January 1, 2020 of this year can enroll in Plan F anyway. Okay, just a couple of other things that I want to talk about. If you hopefully you will use this for your Medicare supplement. Again, if not, I highly recommend that you do get one. As you can see through some of the slides and the coverage information that we provided, your out-of-pocket could be quite a bit if you do not have a Medicare supplement. So I'd highly recommend that you do get one. If you do go through us, the thing to note, you do not have to be a member of the GDA to use this for your Medicare supplement. Also, if you currently have your health insurance coverage through us and you're covering your spouse and children, again, you have to already be insured with us. If you go on Medicare, we can actually grandfather your spouse over to their own policy at that time, since they are already covered through us. So you don't have to worry about if you go on Medicare that your spouse is going to lose their coverage. Again, we can just grandfather them over onto their own policy, and they would be able to stay on our health insurance coverage up until they decided to come off or enroll in Medicare. Again, we have our website posted right there. It's gdaplus.com/Medicare. We have our Anthem booklet. And if you do decide to use us, we have the application on there. You can look it over. It may take 10 minutes to complete the application. It's not very long at all, especially if you're in your guaranteed issue period. You don't even have to answer the health history questions, so it's pretty quick. We'll open it up for questions. If you have any questions and had rather contact me directly, that is totally fine. You see the phone number posted there on the website, or you can email me also at christy@gadental.org.
So we're just gonna ask, if you have any questions, can you hit the raise your hand and I will unmute you so that you can speak or ask your question. Any questions? All right, we have a question from Brenda. Hi, Brenda. Oh. Are you speaking, Brenda? Hold on, having some technical difficulties here. There we go. Brenda? So we're gonna go to John until we can hear from Brenda. John, you had a question?
I do. Can you hear me?
Yes, this is Brenda?
Yes. No, this
Okay.
is Kathy Goddard.
Oh, Kathy Goddard, okay. Go ahead with your question.
Well, this was very informative. I just wanted to know if there's any way to replay this later so we can go through it again.
Oh, I'm so happy you said that. That was one thing I forgot to mention. We are going to have the entire webinar posted on our website sometime next week. So again, the website is right there, gdaplus.com/Medicare. And if you have, there's no user ID or password required to get onto the website. So if you have any friends or relatives or neighbors that would also benefit maybe from listening to this, they are more than welcome to go to our website, listen to it, and and I'm more than happy to help them with their Medicare supplement.
Christy, thank you so much. I had several interruptions during your speech and I didn't want to miss it, so I will look for it next week. Thank you.
Okay, that's awesome. Thank you for attending today.
Okay, thanks. Bye.
Bye-bye.
Any other questions?
Okay, if you would like to ask a question and maybe having technical difficulties with muting or unmuting, or just would like to contact me directly, like I said, that is totally fine. My phone number is posted right there on the end of the webpage, and also via email at christy@gadental.org. So I don't think we have any more questions right now. So hopefully that means you found this useful, and I did answer your questions and it was informative for you. So I know Medicare, most people have never dealt with it before, and there's so many parts to it, it can be a little confusing and overwhelming. So hopefully I've helped answer some of those questions and calm some of those fears with Medicare. And if I can be of help in the future with it, please absolutely just give me a call or just contact me. Thank you so much. I hope you enjoy the rest of your day and have a great weekend. Thank you.